So back again today is Naturopathic Dr. Kate Rhéaume. Dr. Kate is a graduate and former faculty member of the Canadian College of Naturopathic Medicine, an international lecturer, and a frequent guest on radio and television right across North America, and also a best-selling author. Dr. Kate, you're going to talk to us today on endothelial health. Now, what is that? Could you explain, and why is that so important?
First of all, welcome to the summit. It's great. Kudos to you for taking time out of your busy schedules to take steps to improve your own health. And this topic in particular is one that is arguably a matter of life and death, talking about heart health. Heart disease, heart attacks, and strokes are the leading killer of men and women globally, as well as in North America. It affects men and women. It tends to affect women a little bit later in life than men, but it affects us both. And when I say heart disease, when you hear the term heart disease, what does that mean? Well, that's an umbrella term, kind of a general term that refers not just to the health of the heart muscle itself, but the blood vessels that feed the heart. Those three main coronary arteries, if those get affected, that can lead to heart attacks, as well as the health of all of your blood vessels. That includes the ones in your brain. If those are affected, that can lead to strokes. So this is an umbrella term when we say heart health, but that's what we're referring to. And as I said, an important topic because it is a major killer, and it's one around which there has been some misinformation, maybe even misdirection, and our focus around heart health to this point might in fact have led us astray in being able to protect ourselves most effectively. So I'm going to look at a couple of heart health myths, then look at the facts, and then provide you with a different way to think about your heart health that might be more helpful. So heart health myth number one is that cholesterol causes heart disease, cholesterol causes heart attacks. This is probably the single biggest myth and misconception when we're talking about heart health. And the fact is that 50% of all heart attack patients have normal cholesterol levels at the time of their heart attack and no history of ever having had high cholesterol. So that's concerning for a few reasons. First of all, if you're using cholesterol as a guide for your heart health, you go get it tested and it's normal. You may think, hey, I'm not at risk of having a heart attack, but that may not be the case. And so that can lead us astray in that sense. And there may be better ways to understand heart health from a functional perspective. So look at myth number two, that cholesterol levels are a good predictor of whether you will have a heart attack. Well, based on what I just said, you can probably already guess that that is not true. And as a matter of fact, in the studies that have looked at this, and there have been quite a few of them, including one, for example, that was published not too long ago, a review in the British Medical Journal, looking at a collection of different studies. For people 60 and over, there seems to be either no association between cholesterol and mortality, or an inverse association between cholesterol and mortality. What that means is that for the people with the lowest levels of cholesterol, they had, in fact, the highest levels of mortality, or higher risk, for example, of dying earlier or dying from any cause, including heart attack. Conversely, people with higher levels of cholesterol had lower mortality, suggesting perhaps cholesterol might have some sort of protective effect. I don't want to get started. I would actually love to get started, but I'm not going to get started on cholesterol, what it does, its role in the body, statin medications and their use, when you should be concerned about cholesterol and when you shouldn't. That's a whole other topic. But what I want to do today is provide you with a more functional way of thinking about your heart health, cholesterol aside, that may help guide you to take steps to improve your heart health and reduce your risk of heart disease. So one of the other major myths around heart health is that blood vessels are simply tubes or pipes that can get clogged. And that is absolutely false. That is absolutely not the case for lots of reasons. And the main one is that blood vessels have a dynamic lining called the endothelium. So this endothelium is a lining or a layer that's one cell layer thick inside the blood vessels. And this dynamic lining protects and regulates the health of the blood vessels. So this is critical. And when cardiovascular disease occurs, this in fact can be considered as due to a failure of or dysfunction in your endothelium. Changes in the functioning of the endothelial cells play a central role in the disease process of many conditions, including blood vessel disease, stroke, heart disease, diabetes, insulin resistance, and severe viral illness. And so when these things happen, or when heart disease happens, you can think that your endothelium has not been doing its job and then want to wonder why. So in fact, it becomes very useful to think of your endothelium, so the lining of all of those blood vessels, as an organ. We know a lot about, for example, your brain as an organ and how to take care of it, or your intestines and other organs in the body. And if you think about your endothelium, that becomes, as an organ, that becomes a very useful way to be proactive about your heart health. So how do we take care of our endothelium? Well, let me talk first about a few things that are helpful for the endothelium. First of all, exercise. This shouldn't come as a surprise. We know exercise is good for everything: general health, brain health, mood, and heart health, of course. But specifically, exercise will release compounds that is beneficial for that lining of your blood vessels. Next, antioxidants. Antioxidants fight free radicals. Free radicals are damaging to the cells of the endothelium, so antioxidants are important. I'll touch on those a little bit more later. Lowering your sugar intake. High sugar intake and high insulin levels, not good for the endothelium. Omega-3 essential fatty acids are very beneficial for the lining of your blood vessels. The Mediterranean diet, for example, has been shown in studies to be beneficial to the endothelium. The Mediterranean diet is characterized by a wide variety of fruits and vegetables, which may be one of the keys here that I'll touch on later, as well as moderate intake of whole grains, meats, fish, poultry, and other healthy things like olive oil and red wine. And then finally, laughter has been shown to be helpful for your endothelium, and I'm going to touch on that more later as well. What's harmful for the endothelium? What kinds of things are not good that can increase our risk for heart disease? Well, being sedentary, being a couch potato, sitting around and doing nothing, promotes inflammation. It's counterintuitive. How can you promote inflammation by doing nothing? But in fact, that's exactly what happens. So not exercising, not good for the endothelium. Next, smoking. This is an obvious one, but it's absolutely worth mentioning. Generates a lot of free radicals. In particular, that seems to be the big problem. Of course, lots of toxins. The endothelium doesn't like that and increases the risk of all kinds of illness. Stress. Stress and the overproduction of stress hormones and excessive stress will damage very quickly that lining of the endothelium, and which is why it's associated with increased risk of so many kinds of health conditions. Free radicals, as I mentioned before, are problematic for the lining of our blood vessels and inflammation. High sugar intake, the sugar itself, as well as the insulin that levels that it jacks up, not good either. Lack of quality sleep is absolutely associated with poor quality or dysfunction in the endothelium. Too much omega-6 fatty acids. So these are fatty acids that are overrepresented in the Western diet. You can find these things in vegetable oils, especially ones coming from seeds, things like canola oil, for example. They tend to have inflammatory properties and are associated with poor endothelial function. Trans fats as well fall into that same category of fats that aren't helpful for the lining of your blood vessels. And then finally, lack of key nutrients. So just when, like we think of other organs in the body and that we know there are certain nutrients that are helpful for them, the endothelium has its own nutrients that is beneficial, that will keep those cells working properly and doing their job properly. There's lots of them that we could talk about. I already touched on omega-3, but here's a handful of ones that I think are especially important and or have been overlooked. So although this isn't an exhaustive or extensive list, I want to highlight these nutrients for the purposes of this talk. Okay, so some of the nutrients that are helpful to heal the endothelium. At a glance, there is vitamin K2. There's also the mineral magnesium. There's the bioflavonoid quercetin. There is the healthy fat omega-3 that I've already touched on. There's the herb active ingredient from the herb turmeric, which is called curcumin, as well as vitamin C. just at a glance, these are top nutrients that are helpful for the endothelium. So let's start with vitamin K2. This is a nutrient that is near and dear to my heart, which is why I wrote a book about it, because vitamin K2 is a nutrient that is extremely helpful for many aspects of health, but especially for heart health and cardiovascular health. And it was one that was overlooked for very long periods of time and still is underappreciated or sometimes misunderstood. So vitamin K2 is a fat-soluble vitamin like vitamins D and A, and it is one that will help guide calcium around the body. Among other things, it will help direct calcium into the bones and teeth where you want it, and it helps to prevent and even reverse calcifications in arteries and other areas of the body where you don't want calcium to be residing. So when we talk about, for example, hardening of the arteries, why are the arteries getting hard? Well, because they are becoming calcified, or calcium is depositing in those elastic tissues of the arteries, causing them to stiffen. So vitamin K2 helps reduce this, and it does so by acting on the endothelial cells, helping them change the environment to clear out the calcium from the surrounding tissues. So extremely important nutrient for cardiovascular health and endothelial health, and one that has been underappreciated. Where do you find vitamin K2 in your diet? Well, there are two main sources of vitamin K2. One is from animal foods. You'll find this being a fat-soluble vitamin in things like egg yolks, butter, and certain types of animal fat. Goose happens to be one of them, goose liver in particular. But more so if those animals are eating grass. So eating grass increases the vitamin K2 content of your foods. So you will get a little bit of vitamin K2 in your average store-bought grocery store egg raised in a cage. But you'd have to eat about a dozen of those eggs to get a worthwhile amount of vitamin K2. Whereas a grass-fed egg, if the hens are really out on the pasture eating grass, you get those lovely orange yolks at the right time of the year. Just 2 of those will give you plenty of vitamin K2. The other source of vitamin K2 in your diet is fermented foods. Fermented foods are much more common, for example, in the Mediterranean diet in many parts of Europe than they are in the North American diet. This is significant. And this is because some, but not all, bacteria have the ability to produce vitamin K2. So some types of fermented foods, notably special types of cheeses, brie, Gouda, Jarlsberg, Gruyere cheese, are very high in vitamin K2. So if you want a heart-healthy snack, to be honest, you can't beat brie cheese and a glass of red wine. Now, for the plant-based eaters, you may be wondering, how can I get this nutrient? You're in luck too, because it happens to be the single highest food in vitamin K2 is a plant-based food. There's a traditional Japanese soybean food, fermented, called natto. This is a common breakfast food in some, but not all areas of Japan. Studies show that people who eat this in the areas where they eat this enjoy better cardiovascular and bone health, and it really does make a difference. There's been quite a bit of research on vitamin K2 from this and other sources in terms of heart health. So natto, if you can find it, for example, at your local Asian grocery store and learn to develop a taste for it, that may be the trickier part, but lots of people love it, so I do encourage you to try it. If you feel like you're not eating enough cheese or enough natto, then a supplement is a wonderful option to make sure you're getting vitamin K2 into your diet. For Canadian shoppers who may be listening to this health summit, I do recommend to look for MK7 on the label. MK7 stands for menaquinone 7. That's the technical name for a type of vitamin K2 that works in very small amounts. And so just a single daily dose of your typical soft gel or capsule will have 100 to 100 micrograms. That's a great dose for health maintenance. All right, next. By the way, when it comes to vitamin K2, speak to your doctor if you're taking blood thinners. So next nutrient that is been shown to absolutely be helpful for endothelial health is magnesium. Love magnesium. It is my desert island nutrient, in that if I was going to a desert island and I could only take one nutrient with me, what would it be, or one supplement with me? You think it would be vitamin K2, since I wrote a book on that. But in fact, it would be magnesium, because it does so many great things. We know this is the anti-stress mineral. It supports healthy blood pressure. It works with vitamin K2 in the body to help keep calcium in its place. And specifically, it does support endothelial function. This is how, for example, it lowers blood pressure and has all these beneficial effects. Low magnesium levels, which are fairly common, contribute to endothelial dysfunction. And that absolutely is an important role to play in cardiovascular health. So food sources of magnesium include things like green leafy vegetables, nuts and seeds, and legumes. And it's important to get those into your diet. However, the recommended daily intake of magnesium is around 400 milligrams per day for adults. And you have to keep in mind that recommended daily intake is often the minimum that you need to be healthy, and so more is often better. So, making an effort to get that in through your diet and considering a magnesium supplement, those are especially nice at night before you go to bed, helps relax muscles and improve sleep quality, nice peaceful sleep quality. When it comes to magnesium supplements, there are lots of different types on the market. I tend to look at two main types. You've got magnesium citrate. I like that because it tends to be inexpensive, effective, quite predictable in its effects. And you can get that in powders that you can mix into drinks, capsules, chewable tablets. There's lots of different forms of magnesium citrate supplements. For people who find that they have sensitive stomachs and magnesium citrate goes straight through them, shall we say, then magnesium bisglycinate is a nice option when it comes to magnesium supplements. That's gentler on the stomach, and it's one available as well in a variety of forms. So that is magnesium and ways to get extra magnesium into your diet. Okay, so nutrients, last but not least, there is quercetin. Quercetin is a nutrient that not as many people are aware of as they are with other vitamins and minerals. This is a bioflavonoid. It's a vitamin-like compound that exists in varying amounts in a wide range of foods. Many foods that contain vitamin C, for example, since these two work together, and it was discovered by the same person who discovered and won the Nobel Prize for discovering vitamin C. But you can find quercetin in, as I said, many types of plant foods. So capers happen to be the highest known food for quercetin. You can also find this in appreciable amounts in onions, especially red onions, a number of different types of herbs, dill, cilantro, watercress, radicchio. And in fact, it may be that high quercetin intake is one of the key beneficial aspects of the Mediterranean diet. So one of the main reasons that the Mediterranean diet, in fact, is so heart healthy is because of this high intake of quercetin from so many different food sources. So officially, quercetin is recognized as an antioxidant, which of course will be beneficial for your endothelium and other aspects of health. And it is also known to be a blood vessel protectant, again, because of its benefits to the lining of your blood vessels. So when you are, ideally, like I encourage people to eat a wide range of these kinds of foods to get lots of quercetin into their diet. But if you're concerned about optimizing your endothelial health, then again, you may want to consider supplemental forms. When it comes to supplemental quercetin, there are different types on the market. A standard one is good, but it's one of these nutrients that benefits from having enhanced absorption. So taking the quercetin and doing something with it, either adding it to other ingredients or changing it in a way that improves the absorption, because it's not highly absorbable on its own. So as an example, there is quercetin lipomicelle matrix. This is an example of using a micelle technology to increase absorption. You take the quercetin, you mix it with ingredients that cause it to form tiny droplets, and this will increase the absorption of the quercetin by 10 times. So that's an example of something to look for when you're shopping for quercetin supplements. And finally, last but not least, I mentioned laughter earlier on. Laughter being good for your endothelium, that's not just a nice idea. In fact, this is backed by science. A 2005 study conducted at the University of Maryland School of Medicine showed that laughter causes the endothelium to dilate or expand to increase blood flow. And so that is good for you. It's scientifically proven. And I hope that's a good note to end on. And I also hope I've provided you with a more functional way to think about your heart health.